Dr. Yuan-Chin is going to come up and introduce our next presentation and speaker.
Thank you, Kelly. Before I introduce the next speaker, I do have to give kudos and give appreciation to the resource that we have in our Tri-County area with Therese. Many don't know, but was it Harvard that you were just talking about that has reached out and wants to learn more about this model and how to train more physicians in at least recognizing and understanding what eating disorders are. In my residency and medical school training, we had very, very little. And as you can hear about from both Therese and Alicia, this is the mental disorder that has the highest death rate. So we as a population have to do something about this. Much like we normalized over the last few years mental health. Before we had stigmas with mental health and we didn't want to talk about it. That stigma is still there with eating disorders. So we have to normalize as much as we can that eating disorders are out there in an effort to get people help, to get physicians trained as to what to recognize when a person with an eating disorder comes into their office, and then what are the next steps? How do we train the trainers in this model so that we have those available resources throughout our Tri-County area? So you might notice a theme today. We had a wonderful, nutritious meal. We've talked about eating disorders, but what if we didn't have enough food to even go around? How does that impact our day-to-day health? So as I was eating my salad, I know that fiber goes into my stomach, goes into my intestines. There's benefits from that fiber going in. From some of the protein that we had, that protein is broken down into amino acids. Those amino acids help repair a muscle that may have been torn. But what if we weren't getting that proper mix of all of these proper ingredients that need to come into our body? Do we have adverse health effects because of eating the wrong mix of foods and not getting the right proportions? What if we didn't have access to that food in the first place? So food insecurity. So that's our next topic, and I'm really excited to present a guest speaker regarding food insecurity and health disparities. We're very honored to have Dr. Stephanie Grutzmacher, and she's assistant professor at Oregon State University. She relocated from Maryland a couple of years ago. Her father lives in Toledo, and we're really honored to have her here with us talking about food insecurity and health disparities. So Stephanie.
Good evening, everyone. How are you doing tonight? Good. You talk about food insecurity after the meal. So anyone who is experiencing food insecurity can absorb the presentation, and anyone who wasn't thinking about it beforehand can now reflect back on that opportunity. So I'm going to talk about food security in terms of what it means for community food systems, what it means for individuals who might have the experience of food insecurity, and also I think we can brainstorm about what it might have to do with the provision of CCO services to the community. So when we think about food insecurity, we often think about people don't have enough food, and that generally is where the conversation stops. So people don't have enough, they're not getting enough calories, but we really don't dive all that deeply into what that really means and how that really impacts people. So when I teach students about food insecurity, I teach a class on food insecurity, we talk about dimensions of the food system that might increase or decrease an individual or a family's risk for food insecurity. And we also talk about the different layers or different dimensions of the experience that people might have as well. So in the community, we have issues with availability. Is something around for someone to buy? We have issues with accessibility. So even if it's there, can an individual householder afford to or get to a place to purchase those things? Affordability is something that we really need to think carefully about, as most of the really nutrient-dense foods that are available in the grocery store or at the farmer's market, they tend to be the most expensive things that we can buy per calorie. So we might say to ourselves, well, buying all that processed food in the junk food aisle at the grocery store, it really doesn't cost that much less than the fruits and vegetables. But when you think about meeting a family's caloric needs, if you need 2,000 calories a day for each person in a household, give or take, it costs a lot more money to buy 2,000 calories of fruits and vegetables and whole grains than it does to buy 2,000 calories of Cheetos or all the other interesting manufactured foods that we often have access to. We also think about what's usable and what's stable in the food system. So there's times of year when things aren't available. There might be forms in which something isn't usable. And all these different factors contribute to whether or not individuals have a food system in their community that provides for their basic needs. Beyond what's happening in the community, though, we have all of these things that food does for us as individuals. So quantity we talked about. Quantity is whether or not there is enough on a plate. This is often a concern for low-income families or families that might be in and out of some economic risk. Maybe they have cyclic employment or seasonal employment. Maybe there's difficult times of the year for a family. But the other things that we don't often talk about are quality. So you mentioned it in your introduction. When a family has enough money to buy enough calories, but they don't have enough money to buy variety, or they don't have enough money to buy quality or nutrient-dense foods, then that would be considered a challenge of food insecurity as well. The suitability of foods. Some people might think this is getting a little picky, but whether a food is liked or preferred, and that might be in a personal sense, it might be in a cultural sense. If something is not considered suitable by a household, then having access to that thing really might not be all that helpful. So an example of addressing suitability might happen in food pantries. So if food pantries stock 1 million cans of sardines and tons of peanut butter and I don't know what is also common, like lots of boxes of cereal. For a household that might have come to the area from Central America, boxes of cereal and jars of peanut butter are not culturally relevant foods. And so even though they might be nutritious to some extent, they might be available at the food pantry, they aren't necessarily reflective of what that family's food preferences might be. And just the sort of alienness of that food can create problems for families. Of course, people want to meet that quantity need first, so people often overlook this. But if we're trying to increase food access that really meets all these different dimensions, thinking about suitability is important as well. And obviously, food meets psychological and social needs. The inability to meet those basic needs creates sometimes psychological and social problems. So a lot of the research that I do examines the psychological and social impacts of food insecurity and how it sort of undermines our ability to live our lives in other ways. So this isn't just about food. This is about whether you can have people over to your home for a meal, or whether you can share in celebrations with other people over food. Is there a cake available for a birthday? Can you repay a favor to someone who gives you food? There's so many different things that might impact people's ability to engage over food. Food is very common in our lives. We eat for all kinds of reasons and in all kinds of settings and with all kinds of people. And when we have to extract ourselves from those situations because we can't contribute equally, that creates a lot of problems for people. One of the other areas of research that I pursue looks at how families that are food insecure try to engage reciprocally, though, when they do receive help from people. So some families might have, an excess of milk that they got from the WIC program, but they don't drink milk, and they might trade that household item for another food item that another family might have in excess. For example, a family who hunts or fishes or something like that, or has a garden. So there's actually a lot of really interesting strategies that people use to meet that quantity need, and that's usually the first problem that we can solve. These other things tend to come after that and are a little bit more difficult to address. So Oregon is kind of an interesting case. Oregon has one of the highest food insecurity rates in the country. The national rate, this is from 2015, the 2016 data isn't out yet. The national rate is about 14%, and the rate in Oregon is 16.1%. Here in Lincoln County, it's 17.5%. So there's really a lot more risk here, and maybe a lot more just sort of teetering on the edge in terms of the food system and the reliability of that system, and whether or not individuals and households have what they need to get the food that they need. I probably could have a really long conversation with lots of different people about why this is the case, but maybe we can take some guesses about that if we have some time. So food insecurity, more or less, can be considered a proxy for poverty or economic insecurity. So when we see poverty go up, we see food insecurity go up. When we see poverty go down, we see food insecurity go down. And we know that in households and in communities where there's economic instability, meaning that either things aren't going well or they're not going well at least sometimes, we see really poor food outcomes in terms of their ability to make ends meet. So households that are dealing with unemployment, whether that's short-term or long-term, households where there are low wages being earned, people who have seasonal jobs where they might be making money during the summer or the fall but not have access to employment during the winter, and families who live in areas that have really limited safety nets. So food insecurity in the US has been largely addressed by to a great extent, not centrally organized system of food pantries. There are food pantries and food banks all over the country that do their best, with varying degrees of success, to meet people's unmet food needs. But in areas where that largely private system is not functioning or is not big enough to meet needs, then people simply go without. So living in an area that has a more limited network or a limited safety net also provides challenges to families. Food availability, access, and costs are also significant. I already mentioned some of the reasons why that undermines ability to provide food. We have right now a system where the most healthful things can be the most expensive, and where the calories that especially when we think about BMI and obesity, overweight issues, the calories that are just all over the place and everywhere and accessible tend to be very, very cheap as well. And if what an individual is after is a feeling of satisfaction or getting rid of a feeling of hunger, then kind of all calories are equal in some sense. But in that nutrition context, they're certainly not equal at all. So food security is more likely to occur in certain contexts. Vulnerable family structures like grandparent-headed families, single-parent families, especially single mother-headed families, families where members of the family are in vulnerable life stages. So this really mostly refers to aging adults or to being a child. Being a child is a significant risk factor for experiencing food insecurity. Isolation that's associated with living in rural areas is a huge contributor. We also, you might have heard of food deserts. That's like a thing that gets tossed around a little bit in the media these days. Food deserts refer to communities where there's no access to basically like a supermarket, where you can get a large variety of reasonably affordable foods. And urban areas, dense urban areas, and rural areas both tend to have food deserts, although we would probably define them differently. We don't always capture the resources, by the way, of rural communities, because a lot of people in those areas might do things on their own that aren't really in the market where they're exchanging money for food to try to get their food needs met, like hunting, fishing, having a household garden, food preservation, lots of those kinds of things. But we find even with those resources that people still struggle in rural areas to make their food ends meet, more so than suburban communities. But ever since the economic downturn in 2007, 2008, we do see lots and lots of suburban families for the first time enrolling in the food stamp program, and for the first time kind of showing up as food insecure. We also see lots of racial, ethnic, and gender disparities with regard to food insecurity, with women being at high risk, Hispanic and Latino families, and Black or African American families at high risk. And again, I'll mention again because it's a really significant challenge for communities, places where there is a weak safety net, a weak public or private safety net, So there's limited access to federal nutrition programs like school meals programs, or there's limited access to a food pantry system that has sufficient resources to meet the community's needs. Those are places where we would look to see the impact of food insecurity be even worse than in other types of contexts. So in Lincoln County, almost a third of the population is eligible for the food stamp program, which we now call SNAP. This is pretty high. Not everybody who's eligible participates in the program, and mostly seniors are the group of people that we see who are eligible but not signing up. And that might be because the benefit often is very small for seniors because they have maybe some other forms of retirement income that count against their eligibility. But by and large, people who are eligible for SNAP might have misperceptions about their eligibility. They might not think that they're eligible even though they are. There are some burdens with paperwork and with recertifying for SNAP that often keep people out of the program who could be receiving it. And then the perception that the benefits aren't significant enough for the trouble that you would have to go through is another key reason why we see people who are eligible but not participating. In Lincoln County, some of those contextual factors that I mentioned are really important here. Seasonal employment and low wages, so tourism related, or some of the other industries, food and fishing, those are things that aren't necessarily year-round jobs for people. There are also higher food costs in Lincoln County than many other parts of the state and country. Gas prices are also higher, and the distance to grocery stores is greater. About 10 years ago, the Oregon Food Bank helped each county produce basically a community food systems report. Some of those data are getting a little bit dated at this point, but that report contains an itemized list of all of the retail outlets that provide food within Lincoln County. And the number of retailers that have a really limited selection and really high prices, it's pretty significant. So people might be doing their weekly shopping or bi-weekly shopping at a place like that where your money just doesn't go as far as it might at a supermarket. At the same time, the owners of those stores also struggle to make ends meet and have to have their prices that high in order to stay open. So it's a little bit of a catch-22 to figure out how to make food more affordable and accessible and not undermine the employment of the people who run those types of businesses at the same time. So this is just to underscore the point about the recession and about how food insecurity really mirrors what's happening in the broader economy. So this shows the rates of food insecurity over time. And if you remember how the last 20 years has gone, you can remember the not so good years economically and some of the better years and see that this really directly mirrors. This is also what happens with SNAP participation. So every now and again in the media you hear people freaking out that, oh my gosh, everybody's on SNAP now, the whole world is on SNAP. Participation has skyrocketed, but it always mirrors what's going on in the economy. It mirrors unemployment. It mirrors all the recession data that we have about wages, and it mirrors food insecurity data that we have too. So all of these things kind of go up and down together. So you know to expect more food insecure individuals showing up in clinical settings when the economy is not going that well. You can also see in this figure the risk I talked about with regard to family structure. So female-headed households with children, that's the orange line at the top, the highest rate of all of these groups. And the light blue line that's second to the bottom is all households with children. Children increase one's risk for poverty. That's a totally accurate and almost impermeable kind of fact, but when households have access to resources like school meals, backpack programs, et cetera, they tend to do a little bit better despite the fact that kids are really expensive. So there's often a lot of conversation about this idea that low-income households, just don't spend their money wisely, and if they spent their money more wisely, then food insecurity would be less of a problem. So I made this for you. These little dollars show how much low-income families in the U.S. spend on their groceries, divided up by different food categories. And you can see here that that last category, food away from home, is a really substantial proportion of the spending. Does anyone, I know this is being recorded, we can't get the answers. Does anyone have any explanation as to why this is a thing? Why so much food away from home? Do you buy food away from home? Why? Convenience, time, it's for social reasons. You're in transit from A to B, so it's not different for anyone in this group of people either. I mean, being a person who's living with limited resources, you might be driving from job A to job B, you might be driving from picking up kid A to picking up kid B at a different school, and people's lives are hectic. That's more like an American thing than it is a low-income or high-income thing. So the reaction to that sort of being overscheduled and overstressed is to pay for convenience. So actually, these expenditures don't look that much different when we look at what high-income families spend. The difference is how much they spend in total. So this is what everybody else is doing. The food at home is the blue bar on the bottom, and the food away from home is the orange bar. So you can actually see that the richest 20% of people, they spend lots of money away from home. But these other things aren't that different in terms of the proportion of away from home and at home. Where the difference lies is in the total spending. So the total money available to buy food is much, much, much lower for the low-income household. And this is where, yes?
Is that, what period of time is that?
This is annual.
Okay.
I should have said that.
Yeah.
It's an expensive grocery trip, isn't it? Wow, $11,000 of, yeah, it's annual. And when we look specifically at fruit and vegetable spending, I find this really interesting because most of my work aims to get people to eat more fruits and vegetables, low-income people specifically, so I have to battle the part where fruits and vegetables, particularly fresh ones, are not all that affordable. So you see the same pattern emerge here. It's not that people aren't buying fruits and vegetables, and the proportion of processed versus fresh fruits and vegetables that they buy isn't all that different either, but the total expenditure is really, really low. And this is why programs that provide access to fruits and vegetables are absolutely essential to breaking up that link between food insecurity and poverty and poor health outcomes. We have to find a way to make these things accessible and affordable instead of just saying, oh, well, people they can't eat fruits and vegetables. That's too bad. We don't need to spend any time probably thinking about why it's important to eat fruits and vegetables, but I think I've been rambling on too long. So if you're interested, I can provide a link, or we can provide the slides to anyone who is here. I have a video from Hood River, and Hood River, you might have heard, has had a really, really, really successful set of experiments with community food system improvements for everyone in the area, but they've particularly benefited low-income consumers in the area, migrant farm workers and other individuals who live with sort of a long-term vulnerability. And that food system has a lot of different programs and a lot of really cool ideas happening now that are under evaluation to try to figure out how to build up the food system itself so that individuals in those communities can have greater access to affordable fruits and vegetables and other high nutrient-dense foods. In Lincoln County, I thought maybe there would be some folks who'd be interested in some of this, although there are also other people in the room who are much better experts than I on some of these things, so I can point you to them too. Kathy, I met a while ago, is expert in the backpack program, and Stephanie Russell is here too from SNAP-Ed, so if you have questions about those things, you should ask them and not me. But some of the resources that people can participate in that would help with food insecurity are the SNAP program, which is called Oregon Trail in Oregon, the WIC program, which is for pregnant women, nursing women, and children ages 5 or under. And actually, WIC, 50% of the babies in this country are on WIC. So WIC is not a small program. It's not a marginal program for a small number of people. Half of all babies participate in WIC. So this is a huge opportunity to get mothers and small children referred into a program that is very supportive in terms of nutrition outcomes. There's also a nutrition program for farm direct purchases. So there's like SNAP incentives at farmers markets. People who use WIC and SNAP can purchase fresh fruits and vegetables from farmers markets at subsidized rates, essentially, using those coupons. And there are school and summer meals programs in different jurisdictions around the state as well. Additionally, there are community and senior meals programs that generally advertise themselves to be open to everybody, but part of their goal is to reach food insecure populations. There's OSU Extension services that provide nutrition education, including SNAP Ed, but also to general audiences. The SNAP incentive I mentioned that you can use to increase your purchasing power at the farmers market. There are some tribal programs that are aimed at improving food insecurity. There's the Food Share and all of its related programs. And then there are lots, and increasingly more, community and school gardens where people, particularly school children, can grow and have access to produce coming from those sites. So I wanted to just wrap up by saying I think that there are a lot of great opportunities for us to think about the ways in which CCOs can participate in building and strengthening some of the community food resource programs that already exist. I think that, as an example, Fruit and Veggie RX is something that has reflected a partnership between CCOs and community food system organizations. And maybe we can also talk the dirty details of whether that's going to work or not, and whether it's actually going to increase food insecurity or decrease it. But I'm saying that really quietly because I don't really know. But there are so many opportunities for people to identify people in the CCO setting. This is really becoming one place in the community where we can count on seeing members of vulnerable populations, and therefore the opportunity to conduct outreach, nutrition education, and wraparound anti-poverty services is actually really strong. So, thank you.
I'm Rosie Shackin. I am from Florence. I am also the Legislative Policy Advisor to State Senator Arnie Rowland. So I'm happy to be here and be part of this and listen to the conversation on CCO. I'm sure many of you guys know that it's going under a lot of conversation in every legislative session. Somebody tries to tear it down, and now we have a huge piece of initiative out there which will have a huge impact on CCOs in terms of the vote that we're having Representative Joel Parrish, but something that folks are going to vote on, hopefully won't go anywhere. But in any event, in looking at your study, and I can't help but think that there's some synergy in the conversation from earlier and with what you presented. But the question, I think, for Lincoln County as well, why is there such a huge disparity? The second question is, in terms of SNAP, in terms of so many other programs going all the way back to the Clinton administration, when we fundamentally changed how we provide food for poor folks around the country. And now, just recently, this new administration cut a lot of funding for after-school programs. There are a lot of kids who are homeless in Florence go and have food at the Boys and Girls Club. So how much of the legislative, the political world have an impact on this presentation in terms of food security? Because a lot of that has to do with how we fund some of these programs that we're talking about.
Yeah, unfortunately, it's really tremendous. I think, so SNAP has been around for almost 90 years, 80 some years. So it's the largest federal assistance program that we have that's not healthcare. And tons of people participate. Tens of millions of people participate in SNAP. And it used to be something that didn't get caught up in a lot of political conversations. It was one of those things that, similar to, well, as of last week, like CHIP, that you just weren't going to say, I want to cut healthcare for kids. You weren't going to say, I want to cut food programs for hungry kids either. And that's changed in the last 4 or 5 years. So it's very significant. The SNAP extension that went into effect after the economic downturn was extended during the Obama administration and then expired. And a few dozen million people were kicked off of the program within like a 3-month period. So people who do surveillance on food security, you see dramatic spikes in food insecurity, people not sure where to turn, because even during that time, the private safety net programs were very, very stretched. Food banks all over the country report record participation, and that hasn't subsided after the economy has gotten better, largely because that SNAP extension that was there just got kind of yanked all of a sudden. So it's really significant, and the fact is that our community food systems and our community food safety nets are extremely vulnerable to changes at the federal level, because the vast majority of funding for those programs comes from the federal level. So even if the programs appear to be administered locally, there's usually something going on there, except for the church food pantry by and large. But after school feeding programs, summer feeding programs, all the things tied to the school system, there are so many different things that are connected to federal funding. And I think ever since we stumbled over the hump where we can now say we should be cutting programs for hungry kids, then it's sort of like no holds bar in a sense. And a lot of people that work on hunger issues, especially hunger advocacy organizations, there's broad concern that there's no bottom here. That just in the name of saving what actually amounts to a very tiny amount of money in the federal budget, that these things will all go away, and then communities will be left just struggling to figure out how to fill the gaps, because right now community programs deliver using mostly federal dollars. Yeah, I don't mean to sound like super bummy about it, but it's not good. And so that also is probably a call to say that strengthening those local food systems is absolutely essential to kind of insulate ourselves from the consequences of any federal policy changes. And I think there's potential for great changes. If SNAP has a cap, right now, if you're eligible for SNAP, you can get SNAP. There's no waiting list. So the cost of it fluctuates every year based upon how many people are participating. But there have been proposals in Congress. They haven't gotten very far, but there have been proposals to say, this is a block grant from now on. This is how much you're getting. You meet the needs of however many people you can meet, but once it's out, it's out. And so that's an example of something. And when we see the evidence that it comes and goes with good and bad economic times, it's also evidence to say that this thing's going to cost different amounts of money during different years. But the proposal to link it to like a block-style grant would really undermine states' abilities to continue to provide those services for people who need them. And I didn't go into detail on this, and not to ramble and hijack your question in another direction, but it's probably obvious to most people what the health outcomes associated with food insecurity are. But just to ramble off a list of things, we're talking about obesity, and often hunger and obesity don't seem to go together, but there's a paradox that we observe where, especially among adult women, the more food insecure they are and the longer they're food insecure, the more likely they are to be obese. There's issues related to depression and anxiety. There's social isolation. There's inability to focus and stay employed. Your ability to learn and earn are tied to food security, and those are obviously substantial for lots of other reasons. Just outside of health, there's so many other reasons to care about food security. So.